Bore da bawb, a diolch am ymuno gyda ni heddiw ar gyfer cyfarfod rhythwyr Bwrdd Ymddiriedolaeth Gwasanaeth Iechyd Genedlaethol Prifysgol Velindre. Good morning and welcome to Velindre University NHS Trust Board's virtual meeting held in public. Mae'r bwrdd yn gyfrifol am reoli perfformiad a strategaeth yr ymddiriedolaeth. The board is responsible for the strategy and performance of the trust. Byddwch yn gallu arsylwi y cyfarfod heddiw, ond ni fydd cyfle i chi gyfrannu. Rydym yn recordio'r cyfarfod, a bydd copi ohono ar gael ar ein gwefan yn fuan. You join us today as observers, which means you cannot participate in the discussion. A video copy of the meeting will be available on our website as soon as possible. Cadeirydd y cyfarfod heddiw yw cadeirydd y ymddiriedolaeth, yr athro Donamid OBE. Mae 6 aelod annibynnol arall gan y bwrdd, fel y gwelwch o'r wybodaeth a gyflwynir. Today's meeting will be chaired by the Trust Chair, Professor Donamid OBE. As you can see from the slide, the board also includes 6 independent members. Yn ymuno â nhw, mae aelodau bwrdd gweithredol yr ymddiriedolaeth. Joining them today are the Trust's executive board members. Rydym hefyd yn croesawu, today we also welcome Stephen Allen, Prif Swyddog Cyngor Iechyd Cymunedol De Morgannwg, Chief Officer South Glamorgan Community Health Council, David Cogan, Grŵp Ymgysylltu Cleifion Velindre, Velindre Cancer Centre Patient Liaison, a Katrina Ffebri, Archwilio Cymru Audit Wales, ynghyd ag Alan Prosser, Cyfarwyddwr dros dro Gwasanaeth Gwaed Cymru, Interim Director of the Welsh Blood Service. Bydd y cadeirydd yn agor i'n cyfarfod yn awr. The Chair will now open our meeting.
Bore da, a croeso cynnes iawn I bawb. Welcome to the Velindre University NHS Public Trust Board meeting. And as our Head of Communications has just noted, we're pleased to confirm that this meeting is being live streamed today and will be available on the Trust website should members of the public and staff wish to view the meeting later at their convenience. Those of you who've joined the meeting today, which I understand to be a mix of our own staff, the public and the press, I want to say a very warm welcome to you all. So I'd like to call a start to the meeting. We've got a number of matters for approval today. So just to confirm the process for my colleagues for asking questions, if you would please raise your hand and I'll keep a note of who wants to speak. And when I ask if a particular paper has been approved, if you could indicate that you approve by raising your hands. Could I just encourage you to use the chat box sparingly and appropriately, because individuals who might be joining the board later on will have access to all the comments. So just be circumspect in how you use the chat box. It also makes it a little bit easier for me in terms of how many screens I have to look at the same time. But just be a bit circumspect about it, please. I'd like to now go to 1.1, apologies. And we have one apology today, which is Dr. Jazz Abraham, our Executive Medical Director. She may dip in later on, but she has been called to other urgent business today. Steve Allen from CHC has informed us that he will need to leave at 1:45, but I'm hoping we will be completed by then. And then before we get into the rest of the agenda proper, I want to offer an apology that some of the papers for today's meeting went out a little later than is our normal practice, and I apologise to you all for that. And this was due to unforeseen personal circumstances, which, when they arise in the run-up, in the period which is the run-up to the board, that's a bit difficult to manage and control. So apologies for that. And as I want to welcome today, add my welcome to that of our Head of Communications, Non Gwilym, Katrina February from Audit Wales, who always attends. I'm not sure if Bernadette Rowlands is here from an Iron Bevan Community Health Council, but she is expected. Stephen Allen, Cardiff Community Health Council, and welcome to David Cogan, our patient representative. Welcome, David. And to Brenda Chamberlain, also from the CHC. David, I understand you have to leave at 12.
Yes, that's correct, Donna, unfortunately.
Okay. But if there are any issues you want to raise with me at in the next several days, David, please, you're welcome to do that.
Thank you.
1.3 on the agenda, are there any declarations of interest which have not already been made and which are pertinent to the items on today's agenda? Thank you. So if I can go to 1.4, which is the action log. There is only one action which remains open, which is number 2 on the action log. It's the first item on the action log, numbered 2 though, which is to do with urgent decisions over 100k. And this is something that we've been it's been in process for a little while. Lauren or Mark, do you want to give an update on this, please?
Yeah, I'll just briefly say, Chair, that this has taken a little longer than expected when we first set out to have a look at this. It does need a reviewing, clearly, and the scope, as we've worked through it, I think the scope of work has expanded because there's been other things that we've come across that we felt that we needed to address. So it's a little bit bigger than we originally envisaged. And as you can see from the status update there, we are intending to actually have a bit of a wider engagement and consultation process through December. So we are coming towards the end of this, but it's still a little bit of work to be done yet.
So do you think we'll have a paper for January Trust Board?
Hopefully, Chair, yes. Absolutely.
Okay.
So I don't know if Lauren wants to.
Yeah, just to, as you say, Mark, it started off as looking at a form, and actually has become a whole review of the process by which the divisions interact with the process as well. So it's being led by Emma Stevens, and there's a piece of work that is being done really thoroughly with lots of discussion with the divisions as to how this works best in the long term, which is then has all been updated in a new procedure and policies, which will go through consultation now. So just to reassure the board that it's being done thoroughly, which is why it's taking longer.
Well, that makes sense. So thank you for that. So we now move to the consent consent section of our agenda. And the consent part of the agenda considers routine committee business as a single agenda item. But as always, members can ask for items to be moved to the main agenda if a fuller discussion is required. I have notice of 3 items which need to be pulled out. 2.12, which is to do with contract acceptance and expected urgent decisions, 2.21 and 2.22. So I'm going to pull those items out of consent, but I am going to take them now. So the first one is 2.12, and this has been raised by Gareth Jones. So Gareth, if you'd like to raise your issue, and then we'll ask Mark Osland to respond. You're on mute, Gareth. You win the prize for being the first.
I know, thank you. I don't think I'll be the last either today.
That's right, that's right.
But thank you, Chair. This is just to clarify the discussion that was had at the time to approve those requisitions, that's all. And I think I've written to Mark Osland regarding this.
Yes, I just wondered if you could raise the issue that you wrote to Mark about, and then we can take the response.
Yes, I think, Chair, my comment was in relation. There were 2 comments. One was in relation to the private board meeting, and the second was in relation to the public one. So in relation to the public one,
That's right.
I think it relates to, I'm just finding my email. It's in the summary document at the start of the agenda item on the 3rd page. I'm just finding my email.
I've got it, Gareth. If I it was in relation to 2.12 of the public board meeting, which deals with contract acceptance and expected urgent decisions over £100,000 procurement. The 2 comments that you had, and this does relate to part A of the meeting, the public meeting, in the summary document at the start of the agenda item on the 3rd page, the table setting out the summary of decisions refers in row 3 to TSC, the provision of professional legal advisory services, and you've said this is misleading as there are also financial and insurance services which are covered in the actual paper itself, which is in Appendix 3. The reference in the table should be amended, please, by the deletion of the word legal, as otherwise it suggests that the whole of the cost we've been asked to approve is being spent on legal advisors. So, Mark, can I ask if you're content with that?
Yeah, absolutely, Chair. I agree with Gareth. The actual summary page refers to legal advisory services. Whilst it is wider than that. It is legal, financial, and insurance advisory services. Yeah. So the summary sheet should actually be amended to say that, and we can arrange for that to be done.
Yes. Thank you, Chair. So my confusion was because the comments I'd raised with Mark were in fact in relation to agenda item 212 and not in relation to the minutes themselves. But I think the point's been picked up now.
So, and then you had a second point, Gareth, because I've got your email in front of me. I don't know if you have, which was,
I have now, yes.
Do you want to draw that one to our attention then?
Thank you. And again, this is in relation to agenda item 212, that a number of the appendices that are before us are meant to have the name of the lead director that's presenting the paper, and there is a declaration from the lead director that the procurement rules and also standing orders and standing financial instructions have been complied with, and some of them don't have the detail of the lead director, and Mark has confirmed that there is that confirmation in the background, but it's not apparent from the papers.
Mark, do you want to reply to that?
Yes, just to actually confirm what Gareth has just said. Essentially, these requests for approval, actually, we get email confirmation from each of the lead directors before they come to me and before they obviously come to the board. There's obviously an oversight here because the actual name of the director has not been placed at the bottom of 6 of the 11 documents. So that should have been done, and what I can do, if the board wishes me to, I can confirm outside the board meeting the actual name of the director that's associated with those 6, if that would actually just provide the extra reassurance.
I think that would be very helpful, Mark, and I think perhaps going forward, if that name could be put into the papers, that would be helpful for future.
Absolutely, Chair. I mean, as I say, it was an oversight this time. The name should have been apparent on the bottom of the document, absolutely.
So thanks, Gareth, for that. And I used the word minutes inappropriately, Gareth, so I should apologise, not yourself.
No, that's quite right.
I wanted to raise 2.2.1, the Health Inspectorate Wales Annual Report. Nicola, I'm giving you a 30-second warning that I'm going to come to you, but I think that will be all right. On page 60, there is a very small section about Velindre, and it's a very positive report for the Trust. which is excellent in these very difficult circumstances. But it did identify 2 issues where they recommended improvements be made. One was in relation to the Welsh Language Act, and the other one was delays in relation to the complaints procedure. So in relation to the complaints procedure delay, we've a report later on in the agenda which shows 100% compliance with the complaints procedure. So that has clearly moved on, and we'll come to that in due course. But I just wondered if you wanted to comment on the Welsh language issue that HIW have raised there, or maybe I don't know if it's Sarah or yourself.
Yeah, thanks, Chair. I'll come in relation to the complaints, and then Sarah can pick up on the Welsh language issue.
Okay.
In relation to complaints, as you outlined, in the last year we've made significant improvements in our complaint management processes across the trust. Our Q2 performance of responding within 30 working days has the first time reached 100%. Overall, the year to date, we're in the mid-90s. And we do strive to respond to every complaint within 30 days. However, the most complex complaints are those that sometimes take a little bit longer, because it's really important that we get those right. But I'm pleased to report, there is sustained continued improvement in that space. Sarah, do you want to pick up on the Welsh Language Act stuff?
Yes, absolutely. Thank you, Chair. Yeah, absolutely recognise that we need to continue to improve our number of Welsh-speaking staff in the Cancer Centre, and we've got a number of pieces of work ongoing to do that. One of which is around job descriptions and making sure that all job descriptions are language assessed before they are advertised, to make sure that we are reflecting the need to improve our Welsh language numbers of staff. Also, now the Cancer Centre has in place a Welsh language steering group, which is going to take forward and be proactive in terms of moving forward on the active offer, which of course is our ability to actively offer Welsh language services to patients, not just expect them to ask. And that's a very important distinction. So there are a number of pieces of work ongoing in that sphere, Donna.
Thank you, Sarah. Thank you, Nicola. But it was a very positive report. Martin, I can see your hand up.
When you finish with this point, I want to move on, if I may, to item 2.1.5 standing orders.
Well, I go one before that, if I may, Martin. So you've got 2.1.5. Let me write that down. Come to that in a second then. So the next one I wanted to raise, I could have raised it before today, but I've been reading papers over the last 48 hours or so, is 2.2.2, which is to do with WISC's joint committee meeting in October, which set out its provision for stereotactic ablative radiotherapy and brachytherapy, and as a kind of therapy which will be scaled up as a consequence of COVID across the whole of Wales. But of course, that is a service that we provide at Velindre. And I just wanted to ask exec colleagues, are we geared up for this? Are there any issues in terms of capacity, workforce or anything for this service? Steve, could I ask you?
We went around this when the paper was developed. I'm not sure Kath can give a current update of where we are on the Sabre. Kath?
Sorry, no, I'm not able to give any more of an update at this stage, Steve, I'm afraid. But I will come back to everybody outside the at the meeting and follow up with you if that's okay.
Thank you. I just wanted to, WISC are content to commission it. I just wanted to be sure that what does that mean for us, and have we got the capacity? Are we geared up for the implications for this organisation? So if you could provide me with that assurance outside the meeting, Kath, that would be very helpful.
I know that there is work ongoing, but I haven't actually come with an update on the exact position it is at the moment. So rather than give you the latest I'd rather give you the most up to date. But I'll send an email around to everybody after the meeting.
Thank you, Kath. That'll be fine. Martin, 2.1.5.
Thank you, Chair. Just on the standing orders documents, the appendix to the main paper rightly lists the Audit Committee for Shared Services Partnership as being a committee of this board. However, when you look at the list of all the terms of references in the attached documents, there is no reference at all in there. So that's an oversight that needs to be just filled in.
Lauren, can I ask you to respond?
It's a different schedule. I don't want to make it up because I'm getting it wrong. But I think it's Schedule 5 that relates to all the NWSSP governance. It's a different, yeah.
Fine. This is only Schedule 3.
We could have made that clearer.
Okay, that's fine. As long as it's an oversight, as long as it's part of our grand plan, that's fine. Thank you.
Okay, so I don't want to pull any other items out, but I don't want to miss the opportunity to say just one or two things. Under 2.2.3, governance arrangements during COVID update, the final reports following Audit Wales and Internal Audit Advisory Joint Review. Just want to congratulate colleagues for that very positive review, which was an absolute pleasure to read. There are no recommendations. There are items for consideration, which I know are in hand. But that's a very, very positive audit of what took place during and post the first wave of COVID, and the Trust should be rightly proud of that report. You know, if we get a report which gives us limited assurance or whatever, we bring that full to the front of the agenda, and we go through it carefully. And I think it's only right and proper that we acknowledge when there is an exemplary audit. And I just wanted to say congratulations. Nobody's got their hand up. And at the 2.2.5, I just want to remind colleagues about Q3 and Q4 operating plan. So we took Chair's urgent action to approve Q3, Q4, and that was because of Welsh Government deadlines which they set, which they knew were very challenging, and we all acknowledge were very challenging. It was the same across the whole of Wales. So just to provide reassurance that we did have an opportunity to look at Q3, Q4 plan in a board briefing session, and then and pass comment and have debate, which happened, and then it had to be submitted prior to this board meeting. So it's here today just so that we can sign off that we approved it. But I just want to provide assurance to the public and everybody else that the board did have an opportunity to go through this plan in some detail at a board briefing session. So all the items with those issues that have been raised, all the items under consent, we approve or note. And if there are any observations, questions or queries, I'm going to move us on to section 3 of the agenda. The first of which is a presentation about the delivery of convalescent plasma from the Welsh Blood Service, which Alan Prosser, Interim Director of Welsh Blood Service, is going to present. Over to you, Alan.
Many thanks, Chair, and just thanks for the opportunity of being able to talk to you about some of the challenges and opportunities that this project has delivered for us. So I may be a bit Chris Whitty-like going through this slides. I'm going to go through it quite a canter. I know that people have had this and had it published, and then obviously happy to take questions at the end if that's okay. So next slide, please. So just to frame the discussion. So in March, plasma for patients who have recovered from COVID-19, termed convalescent plasma, was identified as a potential treatment for the disease. And as such, around the world, clinical trials were being stood up. So next slide, please. So challenges. It's fair to say when I read back this list, it almost stops me in the tracks. If we think what March was like, our whole collection model as a service was turned upside down. We were running around trying to find venues, apply a socially distanced model. And then Welsh Government was starting to talk to us about, could you introduce a new service for within Welsh Blood Service and for the patients of Wales, really. So a whole list there that, as I said, was a fair challenge at the time for us, which was how are we going to cope, not least significant IT challenges and introducing new chests for the service. Next slide, please. However, as a former chief executive of this trust used to say, with every challenge there are opportunities. So it was fair to say we saw a reduction in demand across Wales because of the initial wave, and obviously Wales going into lockdown. We knew that we had the ability to produce plasma through the whole blood service process, and we knew that we had other sites available to us that potentially could be put on place to support something that we termed plasmapheresis. And again, there was we knew that some of our platforms were able to undertake the tests that were needed to provide antibody tests for screening for that service. Next slide, please. So just in terms of some timelines there, so engagement with Welsh Government started in March, and as such we put in place an All Wales clinical reference group was established, and we actually established an All Wales programme arrangement over and above some internal arrangements in the service, which we will talk about a bit later. We took opportunity through the ability to purchase quickly. We noticed there was a supplier on the market, and we managed to get hold of, at an 11th hour, 10 plasmapheresis machines to support this service delivery. And that was supported by Welsh Government funding, which is earmarked there in early June. Next slide, please. So in terms of the objectives, it was about trying to collect whole plasma from whole blood within clinics. That was the first phase between March and April, and we also identified that we needed support with testing whilst we sorted out the IT within our own service. Phase 2 was really about how do we put in place a plasmapheresis service and utilise a new technology and bring that to Wales, and introduce screening techniques and obviously the testing and a full configuration of our establishment system, which is our donor record from a blood service perspective. Next slide, please. That's just a flavour for the size and scale of this. I think it's fair to say that this was full mobilisation of the service. Again, I look at this and it just frightens me that we were doing this at a time when we were obviously reconfiguring the whole collection model. And I think it's just, it shows the effect of a supply chain operation such as a blood service, of how many places it touches and the type of discussions and groups we needed to establish in terms of governance for the whole project within the service. Next slide, please. So just critical milestones. We were approached in March, and by November, which felt like a 6 to 7 month sprint, we had put in place the first plasmapheresis service within Wales, North and South. And that is the type of project which would, in normal times, take around about 2 years for a service to go live on, from funding to establishment. So I'm extremely proud of the team that has been here, and you know, I think it's a celebration for Wales, and those are just some of the key milestones that occurred over that period of time and that sprint for the service. Next slide, please. So donor recruitment, how are we getting donors? So it's heavily driven. This is in partnership with Public Health Wales, where donors are identified who have been hospitalised and are then invited to see post-recovery whether they're able to actually support the COVID pandemic, and they're invited to contact our service, and then we talk them through a process and bring them through a screening process. Currently that's for males between 70 and 70, and that's invitation by letter. There's some statistics there in terms of the thousands of invitations we've sent out across Wales, expressions of interest, and how we've screened this through. I think what we need to remember within our service, we deal with a healthy population who are called donors, that we were targeting recovered patients who have obviously come out of COVID hospitalisation. So there is obviously a large amount of screening from a donor health perspective that needed to take place, and there's some figures that support that initiative. Next slide, please. In terms of next steps, the service is up and running. We are taking a very different targeted approach now that the service is in place between North and South, in terms of targeting our donors, and we've got a number of initiatives that are going live this week in social media terms, in media terms, that will be promoting this service and trying to stimulate donors to come back through this service. As I've said, we're currently targeting donors who are male and have been hospitalised throughout Wales, and we will be revisiting some of those donors who have been approached first time to see if they'd like to reconsider in the service space. Next slide, please. Remaining challenges for the service. I just thought, as much as there were 2 phases, I really think this is the start of the sprint for the journey for the service. I don't think this should be underestimated. Obviously, as I've said, different donor engagement techniques required. We're keen to put up and stand up West Wales. We've had recruitment difficulties in this space, but I'm hopeful West Wales will be live by January. We're obviously, maintenance of the supply of the product is absolutely key for the clinical trials for us. We're very keen to enable female donation, and we anticipate that should be live in the early part of the new year. That was decoupled in the project because actually there is complexities about females being able to donate because of antibody levels. So we took the decision to bring this service on live pre-year before females were introduced, but we will be introducing that in the early part of the new year. We have to balance the operation of plasmapheresis along with the blood supply. We are going into a winter period, so that there are all those challenges in the dynamics, and I've previously reported into the board and into committee about some of our recruitment challenges and our staffing challenges in the collection space at the time. And I'm also obviously trying to secure funding post March 21 as well, in terms of the challenges for the service. That is a summary of the presentation. I'd just like to put on record my personal thanks to Peter Richardson, the Head of Quality and Safety within the service, who's headed up this whole programme of work. He's held the ring on this project for the service. I'd like to thank everyone involved in the team. And more fundamentally, just another shout out here, Dr. Atherton this week wrote to our trainee clinical scientist, Chloe George, thanking her for her personal input into this service and her work at a national, UK and international level, which was well received. And I think in terms of just, you know, I couldn't be any more proud in terms of being the director of the service and being able to promote what we've been able to do in what has effectively been a 6-month sprint. Thank you very much.
Thank you, Alan, for that presentation. I've had the opportunity to go down to the centre of Talbot Green and look at the new machines that have been, plasmapheresis machines that have been procured in order to underpin this initiative. So we shouldn't underestimate either the amount of work that's gone into validating those machines to get them ready, and our staff volunteering in the first instance to be the guinea pigs on the machines. So I just want to thank, add to your thanks, Alan, thanks to our staff for that. They're tiny. It's amazing to go and look at them. They're just like a printer almost, a little bit bigger, but not much. And absolutely amazing. It's like being in a kind of episode of Doctor Who. When you look at these machines and what they're able to do, and when COVID allows, I think it would be good if some of the board could come down and look at those machines and the difference from what we have been using to these machines, Alan. I think that would be very welcome.
Yeah, you're more than welcome, as and when it does allow. But yeah, thank you very much for that comment.
I've got one query, which I'm sure you're picking up on. 6982 letters resulted in 762 donations, yep, which is very low compared to the number of letters that went out. And I just wondered if you've got, has that left us with a low supply, or is there something we have to do to increase the uptake?
Yeah, I mean, the attrition rate is huge in this space. I think it's fair to say, as I indicated, we're dealing with recovering patients here, not with fit donors, so it's a very different type of population. We're also screening for something which are high antibody levels for the clinical trials. So it is not felt to be efficacious bleeding donors who do not pass the screening test of a high titer of 6 within the service, because that's what goes into the clinical trial. So we've had to balance all of those measures whilst providing that service. But I think now we're stood up, we have different, as I said, engagement techniques, and I think we're going to be sprinting into this project over the coming days to shore up the supply for Wales and across the UK. So
the attrition, if you call it that, is not due to patients not being prepared to donate. It's for clinical reasons as much as anything. It's not about no appetite to be part of the process.
No, the expressions of interest is where people have said that's how many want to give it. But as you know, with giving donation, giving blood is not an easy process, or giving anything. There are certain criteria, there are certain medications, there is a bit about your fitness levels, your hemoglobin levels, etc. All these things need to be taken into account before you enter this, over and above the antibody level, which then leads to the attrition rate that we've obviously seen in this space.
But I think that's an important message. It's not saying that population of Wales who are recovering from COVID are not prepared to gift of this. It's other issues. I think that's an important message that needs to be made clear alongside those statistics.
Yeah, very much so. No, good point.
Any other comments or observations? Stephen? You're on mute, Stephen.
Yes, I know. Yes, thank you, Chair. Just like to thank Alan there for the presentation on the service, which has been set up rather quickly, but actually delivering really affordable, tangible sort of benefits to the wider community. Just one question I was going to ask, and I seen you were asking for funding post sort of March 2021. Excuse me. The question is obviously with the vaccines which are being banded around as being available and all that, and maybe COVID disappearing off our sort of wider sort of use, probably sometime next year, we hope. What will this service be used for post after the COVID backdrop?
So one of the things we're considering is repurposing the machines post the spike. I think at the moment we feel that there is merit in, and the current science is telling us we'll be in this place till at least the summer of next year. So there's something about the funding, but those machines can be repurposed. And there is current consideration about opportunities about what plasma can be used for at a UK level that is currently being discussed and being considered with the main authorities who oversee blood safety, which is SABTO and the MHRA. And we anticipate there might be some statements coming forward, and we may need to prepare for that. I'm having a discussion in Part B of this meeting with the board to discuss some of those issues, but we are ready to think about repurposing of these machines. We now have a footprint. We believe as a service, as a licensed authority, we are well placed to be able to deliver services going forward with these machines and using them full time for the service.
Thank you, Alan.
I'm very pleased to see the space in North Wales in Wrexham being used, because it is it was calling out for something like that to be based there. Kath and I've had discussions in the past about that, and we ummed and ahed about whether it would be desirable, feasible, and all the rest of it. And now COVID's come along, and hey presto, there's a base in North Wales. Nicola, and yes, Nicola, you had your hand up.
Chair, I just wanted to make the board aware of how amazing the team at Welsh Blood have been throughout this time, to emerge as a system leader within this, not only this, but also the role that they're now going to play in the COVID vaccination programme, during a time where they've had the most unprecedented issues with collections and having to remodel, as Alan has described. They have been amazing as a team. I've seen firsthand the professionalism and the dedication that they've shown to this. I just think that, you know, that's absolutely amazing, you know, in times where, you know, it would have been quite easy to put their heads down and just focus on your core business. But no, they haven't done that. They've raised themselves above and looked at how can they really make a contribution much wider to the current situation.
So congratulations and thanks. I know, Steve, do you want to come in and add to that?
Yeah, I had my hand up earlier, Donna, but I think I won't repeat everything that's gone. It's been this and the other things that Kath's mentioned, been strategically really important developments for the service. I think how we capture these and use them to take the service on to the next step is really significant. And I was going to mention the piece about North Wales as well. That's been a really important thing for, I know you and I have talked about this,
yeah,
Kath and I, about and the value that we give to the people up in North Wales and the staff up there.
Yeah,
and how they feel valued by us from an investment in a service which is at the forefront of blood services and blood service collection. I think is a really important message to the people of North Wales. I think we need to focus on and get out there. And there's something towards the end of the year when we do the annual reporting and things of how we capture this whole story, because there's also been the IT upgrade that's gone on over there, which puts us in a really sound place for the future. So in the middle of all the other things, and we'll come on to COVID later and the impact of that, there's been some really huge strategic steps taken in the blood service over the last 9 months.
Which is system leading. Yeah. Absolutely system leading. Yes, point well made, Steve. But we do need to make sure that we do capture that. It's, you know, it's a message that I think the public would welcome. Thank you, Alan. Thank you, Alan, for that. So I'm going to now move us on to section 4 of the agenda. And the first item is 4.1, which is my report, the chair's report. So I provide details in it on about our board briefing meetings, which we've held, which I referred to earlier. We held our AGM on the 22nd of October, which was live streamed, and that went very well. As far as the technology is concerned, it went very well. I think the content also was excellent. As you know, I am the board's champion for veterans, and in that capacity I attended the Reserve Forces and Cadets Association for Wales annual briefing last week, and later today I'm going to attend part of the Employer Recognition Award, because the Trust has been awarded silver status for employer recognition in supporting reservists to deploy. There's a note in there about the staff survey, the new collaboration between Welsh Blood Service and Public Health Wales, which we've just heard about a bit, and improving cancer care in Wales and beyond. I've made some notes about that. We're very proud of our of the charitable funds that have funded ESOL provision for our BAME community in Cardiff and the surrounding areas, and in partnership with Cardiff and Vale College, which has been led by one of our consultants, Dr. Seema Arif, and which was the recipient what's the name of a Times Education Supplement Magazine award. That's a very prestigious award in the education sector, and they won it. And this is about preparing materials that can go into a curriculum, and because the knowledge base of those materials comes from our staff, delivered then by Cardiff and Vale College, and it brings members of a family into college where they can get accreditation for learning about screening. We are moving into learning about blood donation and tissue donation and so on as well. And then that individual who gets some accreditation for their learning is able to go back into their family and support their family to understand matters of early diagnosis and screening and and so on and so forth. And this has been running now for a couple of years and has been very successful. As I say, led by Seema Arif. And I just wanted to also draw your attention to the fact we did have a Remembrance Day event on the 11th of November. Through Lisa Miller, we have outside the front of the Cancer Centre, we have been able to erect a mini cenotaph, a sort of cenotaph, to acknowledge those that have fallen in the service of our country. And our service on Remembrance Day this year was led by Simon Lawrence, who works in our radiology department and who is commanding officer of 203 Wales Field Hospital, and that was streamed live. So those are the main points I wanted to raise in terms of my report. Very exciting note there about research collaboration between ourselves and Cardiff University, funded by both Cardiff University and the Charities Fund, to broaden and develop research capacity for nursing, allied health and clinical scientists. We've appointed both the research professor from Cardiff University and a clinical fellow has been offered a post through a competitive application process. So we're looking forward to the developments there. That's been led by Nicola Williams. And I'll take any questions, comments or observations on my report. Can't see any hands up, so I move on to the CEO update. Steve.
Yes, first of all, Donna, I'd apologise for not having a written update on the agenda today. It will be completed following the meeting today, and it will be posted and posted up. Okay. Just to start with, I'd like to extend my thanks to everybody across the Trust for the continued focus, hard work, commitment and endeavour. This is now 8.5, 9 months since we started reacting to the COVID events. This hasn't been a short-term reaction. I think it's really important we reflect that back to our staff, that we continue to appreciate it and their efforts, and recognise it's not only their work environment that's changed, but actually our whole lives, both individually and collectively as well. And we're having to learn new things and continue to be quite astounding. I'm not sure why it should be, about how far we move. The presentation from Alan earlier was really impressive in terms of what we've achieved in that period of time, and then when you build it up on the other bits as well. I'm trying to think, we've done a count up of some of the changes, and it's between 150 and 200 that we've said we've changed, and my thanks to everybody involved in getting us there and continue to deliver the care and the support to donors that they deserve. So thanks for that, and I'm sure I'm doing that on behalf of the whole team and all of us across the board as well. In terms of items I'd want to pick up, first of all, the process for the joint escalation and intervention arrangements has been completed for this part of the year. We were maintained in routine arrangements following discussions between Welsh Government and Audit Wales and HIW. Clearly, we're really pleased about that. It maintains us as to where we are. It's always a nervous experience because the email just lands, you've got no warning is coming or involvement in the process. I'm really pleased with that, and the copy of the letter will be attached to the report when it gets posted up to the website and with the pack later. Board will be aware that Nuffield are undertaking a piece of work to provide some independent advice on the clinical model following all the concerns that have been raised. They've informed us they plan to publish this report shortly. We'll make arrangements to make sure we receive that in public as a trust board when we receive that, so we can have a discussion about it and set out how we intend to move forward following receipt of the report. We'll come on to COVID and Brexit later, but just to say we have stepped up our management arrangements. We haven't gone to where we were in March, April and May, so we haven't had daily go meetings. We're running that through a weekly goal meeting at the moment in terms of managing that, because actually we put this in more or less into business as usual. So we have the arrangements in place below goals. We still consider the issues that need to come up, so we're on top of that as well. So those are the three things I want to mention here. We have talked about plasmapheresis earlier, so and we're happy to take any questions from the board.
Thank you, Steve. Are there any questions, comments, observations to Steve? Thank you. And staff welfare, Steve, you know, as a current and underpins everything that we're doing, we're very mindful of how busy and how long lasting this busy period has been for our staff. And staff well-being is a key issue that we're concentrating on every day.
Yes, yes it is. And it may well be worth us giving the board a bit of an update in January, Donna, and the arrangements. So we maybe for quality, safety and performance initially, talk about the range of things that we've got in place, so we can both be challenged and assure you about the things that we are doing for staff.
I think that would be a very good idea. Steve, you went very, very quiet at the end. So I don't know if you might, if something's happened to your volume.
Well, is that better?
That's much better.
Right.
Yeah. Okay, so thank you for that. So we come to section 5 on the agenda. We're running a little bit behind. Quality, safety and performance. So the first is 5.10, which is the highlight report for the last quality, safety and performance meeting. Before I hand over to Jan, I want just to say, when we established the new committee structure, one of the things that I was nervous about was, you know, how sighted the board would be across the board. Oh, sorry about having two boards in that sentence. And I felt that one of the strategies to enable that would be how detailed the highlight reports were coming in, because sometimes they have been a bit sparse on detail, and I just feel that this highlight report is exemplary in providing us with sufficient detail to know exactly what has been addressed and covered, and what is concerning, etc., the Quality and Safety Committee. So I just wanted to mention that, Jan, before handing over to you.
Thanks very much, Donna. If I can put that praise firmly at the door of Jade and Emma and Nick for pulling all of this together. I'm delighted to be able to say we've got, after our inaugural meeting, there is nothing that I need to alert the board to, and all of the volume of items are in the assured section. But as you say, there's a substantial number of items. But as we move into this more holistic approach to quality, safety and performance, there are, I think, going to be that assurance we need to be able to pass on to board. So these reports will continue, I think, to be quite lengthy. There was some really brilliant news in it, and a huge amount of thanks to staff. Almost every item during the course of our meeting, what was being flagged up to us was the extra mile that everybody is going, both not only in the Welsh Blood Service but also in the Cancer Centre. And it's a difficult time for people, and what we've seen is really the best in our staff. So this holistic approach of integrating and triangulating data will, I think, give us much more assurance, which we can then hopefully pass on to board. Yeah. I won't go through the items. As you can see, there's a variety of them, going from the performance through the flu jabs and onto workforce issues, but I'm more than happy to take questions. Thank you.
Thanks, Jan. Are there any queries or comments? Nicola.
Thank you, Chair. No comment, no query, but I just wanted to update the board in relation to the influenza vaccination position. It's you know, we've had a fantastic uptake of the vaccine, and as of yesterday, We've had 81.4% of frontline staff in the cancer centre have received the vaccine, and 84.3% of frontline Welsh blood staff. So, you know, a significant, you know, uptake of that vaccination, which is excellent.
We're well on our way to achieving our 90% target then, which was a very stretching target. So congratulations. And please pass on our thanks to all of the staff who've been involved in administering the vaccine. It's been a very busy time, you know, which they've had to do on top of their the usual sort of work, and the good humour with which they carry it out. And we'll be looking to them for the COVID-19 vaccination programme very soon.
Yes, Chair. I was just going to mention a few words on that when we come to the COVID report.
All right, okay, pick it up then. Okay, I'm looking to see. Oh yes, Martin.
I just echo your comments, Donna, about the very detailed highlight report. One question, just generally about process. Are the minutes of the committees now going to come to the board for information? Because I don't see any of them here today. Is there a process for the minutes being shared as well?
Lauren, can I?
No. So the highlight reports are, and the minutes will be published publicly. But if that's something that's just something we haven't discussed, hasn't been part of the process, kind of pre or post these changes. But if that would be useful to think about, we of course can, Martin.
I guess simply because I think that this is a very detailed paper, and I guess covers the vast majority of what was discussed at the meeting. Others may not be, and therefore it's a risk that the board loses sight of some topics that were discussed. So yeah, I don't think we need to have the discussion here today, but it's just something to think about.
Yeah, sure.
It's something we'll keep in mind and see how it develops. But I thought this was it's a much more detailed report than we would normally expect to have, and it does demonstrate you know, the triangulation, because we're having workforce and finance and quality, and it's all coming together, and we'd be able to interrogate any one of those three aspects in that meeting with the right people around the table. So I think it bodes very well for the future, hopefully. Hope that's not fit. Steve?
Yeah, just to add to that, Don, I think it's worth us, once we've probably had 2 rounds of these meetings and 2 board meetings, to take stock of whether the way the reporting is working is delivering for us all. Martin, because there's something we used to highlight reports in the past. There's a lot going on in these committees, and I think we probably just need to do a step back a little bit, have a look at it. Is it working for us? I think the conversations are, but also in terms of, are the papers feeding the right conversation? So I think we just need to go around a couple of meeting cycles, and then we need to take stock.
We did say we'd do that after a year, didn't we? Yeah. Which would give that 2-cycle approach, Steve.
Yeah, I'm just wondering, a year is we probably need to do an interim one, because we'll have had 2 rounds. We'll have a good feel for how it's working by then, and then take stock at the end of the year. Yeah, but it felt like a good conversation in the committee.
Did have a debrief meeting immediately after the meeting of a few of us, just to pick up any immediate learning. Yeah. What worked well, what could we improve on, all of those things. I think we're beginning to build an agenda of that. So, but I take your point, Steve, we do need to be able to step back, because it's an exhausting meeting, can I say, because you're triangulating data, looking at finance through a quality lens, and looking at quality issues through a finance lens, with workforce constantly being in your mind. I think it was a taxing meeting to chair, I can say, and I'm sure everyone afterwards needed a bit of a cup of tea and a sit down.
And a biscuit.
Okay, thanks, Jan. So we now come to 5.1a, which is the terms of reference and operating arrangements for this committee. Which are for final approval here, Lauren?
Yeah, and this is a slight repetition, because all these changes have been updated in the standing orders, which we covered in consent.
That's right. Yeah. So yes, absolutely right. But it is appropriate that it's done it's been back and forth between the two committees. Yeah. Now it has finally been signed off and it's noted in standing orders. That's excellent. Thank you. And then 2.1.5, no hands up, which is the patient and donor experience annual report, which was a very interesting report to read. I've got one comment to make at the end, which is of such pedantry that I'll probably be asked to leave the meeting, but I'll leave it for the end. So, Nick, are you going to talk to this? This is the first time we've had a patient experience report for the entire trust, which I'm very pleased to notice, as opposed to one for the blood service and one for cancer centre. So I think that's an excellent step forward.
It was important to attach this to the quality and safety performance report. It was considered applicably, and you're right, it's the first time we'll pull together. So,
can't hear Nick very well.
Sorry, can you hear me?
You're sounding like a Dalek, Nick. You tell I'm a dog fan, can't you? No.
Any better?
Not really.
We'll get one of the production team to ring you now, Nick.
Okay, thank you.
It was my turn last time and Donna's turn the time before.
Donna,
exactly
do you want to come back? Do you want to come back to this item?
It was just an appendix, but I just wanted, you don't have to speak to it very, very much, Nick, but I did think, although it's been to quality, the board should be cited on it. My comment of immense pedantry is that where you've got graphs and particularly bar charts, where you just use the same colour with slightly different shades, I was finding it very difficult to work it out. So you've got a bar chart with about 5 different shades of green, and I personally found that is absolute pedantry. I know it is. I should be ashamed of myself really for raising it, but I've done it now. I think it's a very good report. It ensures we know what the concerns our patients, as well as what experiences they found, what good experiences they had. What will we do with this report? It's been to quality, been approved there. I just wanted the board to be cited on it. It's such an important document. What will happen to it now? Will it go anywhere? Pardon?
You can hear me now.
No.
No.
Donna, the technical support is saying they can't fix Nicola's sound quickly, so I think we should deal with it after the break, maybe.
Yeah, okay, I'll do that. But anybody want to make any comments before I move on? Thank you. So we come to 5.2, which is COVID update. We'll be having a break after this item. Kath, are you leading on this section?
Yes, I am. Yeah. So the cover paper covers off a number of elements. I just wanted to very quickly touch upon each of them. We are undertaking a review of the clinical principles and the underpinning treatment plan options that we are using within the Cancer Centre. That's a piece of work that's in progress, but you may recall that at the start of the COVID pandemic, we established a set of clinical principles that were the framework to which we worked. That was then updated in anticipation of the recovery period. And we're just undertaking a further review to check if there's anything that's come from the clinical learning from the previous 8 or 9 months that we wish to incorporate in. That work has been undertaken by the oversight group for both SACT and radiotherapy, and it's in the process of just being finally validated and signed off by the senior management team. So we will be able to circulate those to you between now and the next time we meet. We don't anticipate that there's going to be any changes in the overarching principles, but a number of adaptations have been made to the individual plans underneath, and we'll just give you some of the highlights underneath that. But I will let you know that, as I said, between now and the next meeting. Also included is an update on the vision and mission. So how we're articulating to our staff what our priorities are during this time, because as well as responding to COVID and operating within that environment, we also had a range of other activities that we would have been taking forward at the moment. So what that does is it distills down and prioritises the objectives that are in the Q3 and Q4 plan that we signed off, we noted earlier on, that further up the agenda. And so that has been shared with staff to just really give that clarity around what the priorities are at this time. The other thing I'm delighted to be able to update you on, because we've ratified the papers earlier on with Mark, we will be moving on a lease on the Beaubath building on Velindre Road that is accessible also from our site, and we will be using that as soon as possible to provide the replacement space for Maggie's that we made available during the first wave of the pandemic for our staff. We have already made a number of changes over more recent months in terms of accommodating additional capacity in the dining room by putting some screening up and by turning over some of the meeting rooms in the TCS premises to enable to create that space. We also very imaginatively put a booking space in, booking arrangement in, so that staff wouldn't all end up turning up there at the same time. We were able to cycle people through. And in terms of the staff wellbeing, we know that that was really valued, and that will give us that additional capacity. So I know I've kept you waiting a little while for that news, but I'm delighted to be able to share that update in the plans with you. And then we've got Nick back now, so I'm going to do a test of her volume just to see if she has, because I know she wants to update you. She's got the better information than me on the progress with the vaccination programme. That's the other item we wanted to update you on. So I'm going to hand over to Nick tentatively and see if she's fixed.
Can you hear me?
Yeah.
Fantastic.
Excellent.
Oh gosh, excellent. Okay. Thank you, Kath. Yes, so I can truly say that this is a change in probably more than once a day in relation to the landscape around the vaccination. So we've got plans, and at the moment we're working on the plan to commence staff vaccination on the 14th of December. And we will run those vaccinations for those just under 2 weeks prior to Christmas. And we will then need a 21-day period between first and second vaccine. So the vaccinators that provide us with the influenza vaccines so very well at both Welsh Blood and at the Cancer Centre are being mobilised and trained to support us in the administration. Lots of logistics to work through. But we are having daily meetings and working very, very closely on those plans. We may have to move them, depends on what's happening nationally. But we've got, just to give the board assurance that you know, we've got those plans in place.
Well, that is very reassuring. So we may have to move them because there may be a delay, Nick. That's a question in when the vaccine's available. Is that right?
Yeah, we so far we haven't been told there's likely to be a delay, but you know, the national landscape is still slightly unclear around when they will definitely be available and licensed.
Thank you. Thanks for that. So going back then to 5.2 on the COVID update, can I to ask Kath, is there any intention during the second wave to bring patients from the hubs back into Velindre as we did the last time, or are they, because we've only just finished, quite finished moving, repatriating those services back to the health boards? Is there any plans that
we haven't quite finished the repatriation back to the health boards? That will come to fruition through January and February. although we are delighted that we've been able to re-establish the services remotely, as was our intention. No, at the moment we're not anticipating that they will return, and that we will be maintaining those. Obviously, we're open to all sorts of scenarios that could potentially happen, and we'll respond to it on a daily basis. So we're making sure we maintain the flex, but our intent is absolutely to keep the patients being treated as close to home as possible.
Thank you for that. Steve, Ham, did you want to, there's so many Steves in this meeting, that's why I'm using surname. Steve, did you want to come in on COVID? Anything, add to anything?
No, Donna, I think the paper covers it off. I think I just had to cast, none of us know what's going to happen next week, the week after. It's about being flexible and adjusting to the situations that we face. What we have done is make sure we've got a flexible amount of capacity around. But of course, workforce well-being is fundamental in the middle of that. We need a workforce in place to deliver as well.
Thank you, Steve. Yeah, it's such a fast-moving feast, isn't it? Every day is something different, and we have just to be ready to respond.
Chair, did you see Martin had his hand up?
Oh no, I didn't, Martin. Sorry, Martin.
Thank you, Chair. I was just going to respond to the wonderful news about the vaccine potentially being available for our staff on the 14th of December. As you said, it's obviously a movable feast, so we don't quite know the details of this. But as it currently stands, is the planning, have we had sort of indications that volumes will be sufficient to vaccinate all of our staff? And I guess the question is, what are we going to do about prioritising frontline versus other staff? And have you all those kind of thoughts in hand at the moment?
Yeah, there's quite a lot of logistics here, Martin, which would take up the whole board meeting to describe. That there is no supply issue identified. There are more logistical issues in relation to some of the foibles of the vaccine, and once it's mixed, how long it can be, kept for transportation, etc. So, we will have to have a mop-up plan, I think, sort of for staff who may be unwell during the initial vaccination period. And so there's the answer to your question is yes, there will be. We're trying to be as flexible as we can in our approach, but we really want to try and get the majority of our staff vaccinated before the end of January, and that's both vaccinations. That's what we're working on at the moment, but that may well change.
Thank you, Nicola.
Thank you, Martin. Would 11:30 be an appropriate time to break for a comfort break? That's another quarter of an hour. Is that okay? So I want to get to the end of, if I can, the end of 5.4 before we take a break. So if I can go to 5.3.2, which is EU exit and EU transition. And these items are for noting, but Carl, I'm going to hand over to you to speak to these items.
Have you not skipped 531?
Yeah.
Yeah, yes, Lauren, because I was contemplating a break. Sorry, Lauren. I missed 5.3.1.
No problem. So it's just there's
5.3, sorry, and 3.1.
5.3, yeah.
Yeah.
So there's three aspects to the risk update today. One, I'll just provide an overview of the progress we're making on the trust risk register based on the updated framework that was approved in the September board. Secondly, we can go through the progress on the trust assurance framework following discussion of that at the Strategic Development Committee. And then thirdly, in terms of the content of the risk discussion today, we wanted to focus on the Brexit risk, which is where Alan and Carl's paper will come in. So on the overall trust risk register, as we spoke about in September, there was we approved as a board a pretty fundamental change to the way in which the process would be working, with our reliance on DATEX going forwards as our system for risk management in the organisation, and we approved risk appetite statements based on categories. Just to update the workforce one was outstanding. Yeah, that's the September board, but thank you to Gareth and Sarah. We've gone through that offline, and it occurred to me this morning that ideally that would be brought back for noting into board as a complete set of statements now. So we will, I'll do that for January. As we thought would happen, when we apply that process to the realities of what's currently in Datex and all the refresh work that's been happening across the teams over July, August, September, it's a pretty difficult picture. Datex hasn't been used and kind of exposed in this way for some time, and there'd been cottage kind of processes, including my own for the trust risk register that came to board. It was a Word document that was put together specifically for this purpose, as opposed to being taken directly from the Datex system. So the work to go through and from a data quality perspective is progressing well, and we are we're phasing that over the coming months. As we said in September, we hope to be in a position whereby March the full Datex module will be up and running, with the January board update having had the being able to have the clear view of all risks at board level. So any questions on the trust risk register process before I go on to the assurance framework? Okay, so the assurance framework.
Lauren, thank you.
Thank you. The trust assurance framework is a paper, well, predominantly the same paper that went to the Strategic Development Committee for those who were there. So this is the view of our strategic risks as an organisation, and the in terms of background, just to briefly remind people who weren't at the Strategic Development Committee, is that we've had an outstanding action for some time to create a board assurance framework, as we want to call it, a trust assurance framework, because the importance of this from a best practice perspective of managing risks in organisations is that, as well as the operational management of risk, which is clearly hugely important, and the day-to-day decision making on the back of that, that actually organisations should also have a step back and view of, over the long term, what are the risks to achieving our strategic ambitions. So this is where, as described in 2.5, we held a number of workshops over the late summer, and thanks to all those involved, because that was across many of the executive senior teams, and ended up with a summary of those risks. When we brought it to Strategic Development Committee, there was 1 to 9 there. Really good discussion and build from Stephen in terms of what we now have as 10 in the governance arrangements, and particularly through a quality lens of reflecting on some of the lessons learned from other NHS organisations over the past few years. So it was to update the whole board on that process and the development of the content. And as per the next steps, we're continuing to build these up in a way. We've got all the templates and processes we've already approved. Build all these up now into the full content to come to January's board. Sorry.
Gareth, thank you, Lauren. Gareth.
Thank you, Lauren, and apologies that I wasn't able to attend the strategic committee, but I'm not sure whether this was discussed at the committee, but the draft risk descriptions against the risk themes, I didn't find them all that user friendly, to be honest, and that they appear to have a lot of detail in there and almost a kitchen sink in some of them. I was just wondering whether they could be presented in a slightly a more easily comprehensible fashion, so that people, when they review this, can understand it a bit more clearly. And bullet points, use of bullet points maybe against each of the risk themes.
Yeah, so the way in which it's presented here is just a development point. The presentation won't be like this going forward. So the templates for the trust assurance framework. There's lots of documents in September were part of that overall pack, and we did and they were part of the Strategic Development Committee pack as well. So I'll share them with you because they've probably updated a bit since you've last seen them, and that's how they will be presented going forward. So it's much clearer than this. That this is I'm just very conscious that I didn't want to keep providing process updates on this risk framework work. So it was just important to start sharing the content with you, even though it's still in development into that final presentation.
Okay, fine, thank you.
Any other comments for Lauren? So we were asked to discuss the draft risk descriptions. So Lauren, where do they go from here? Because they're still draft.
They're still in development, yeah. So the score.
Same as see previous answer, I think. Is that right?
Yes, the Strategic Development Committee is the 14th of December. So the next stage of the development will go there and then to Trust Board in January.
So any other comments or observations then for Lauren? So so thank you for the update. Thank you for all the hard work that's going into this, and we look forward to getting the trust assurance framework coming forward in due course for us to sign that off finally. So before I move on, I just need to explain what nearly happened. I turned over my agenda so I could look at when we were due for a break, and then when I turned the page back, I missed out the risk update section completely. But I needn't have worried because about 10 of you jumped on me to say that I missed that bit out. But that's what happened. I was thinking of your welfare and when you would all get a comfort break. So can I go to 5.3.2 then? Carl, I'm not going to do the same introduction. Can I hand over to you to take us through EU exit and EU transition?
Yeah, in 2 minutes, of course.
Yes, please.
Yeah, I'll keep it short. The paper speaks for itself.
Yeah.
I just saw 3 broad areas of update really for the board. One is the current position. Everybody sees the news. Nobody really knows where we are in terms of the negotiations. But there's 2 outstanding issues people will be aware of in the negotiations: UK-EU fair competition and fisheries. And I guess the slight issue is the fact that nothing's agreed until everyone's agreed is the phrase, but I think that is fact. So there are a range of other issues related which have been agreed but would fall away in terms of all sorts of issues. So that's the first point. The second point, we meet weekly, so I attend the national meeting, and I vice chair the SRO's meeting as well, so we're well plugged into all of the existing arrangements. And I think the overriding position largely feels to be that the risks are well understood. There are arrangements in place across the organisation and NHS Wales, but no sense of complacency because you never quite know, do you? But pretty much that's where we are. I'm happy to pick up questions on the paper. I know Alan's not on the line now, but I again would if you were here, I would really give him thanks, and Laurie and Andrew Mapstone and colleagues who really put in hard yards to get into the detail of this, understand supply chains, plans A's, plans B's, plans C's. So huge amount of work, but we're awaiting an outcome really to understand exactly what's in front of us over the next couple of weeks, and then from the 1st of January onwards as these things sort of kick into shape.
So presumably this work will carry on post January the 1st when we will have some idea where we are.
Yes, Chair. Yeah, I mean, in many respects, these are business continuity plans, aren't they? But clearly they're at an acute stage. I mean, the general feel is there will be disruption, come what may, whatever deal is in place or otherwise, for a number of weeks, probably 12 to 24 weeks post January the 1st for all the reasons we can imagine, just simple things like hauliers having licensing agreements in place to ship products back and forth. So it'll be bumpier than it is now. Nobody really knows, but yeah, this will run probably 6 months. I would guesstimate, but that's just a guesstimate in terms of us settling things down. And I don't mean our organisation, I mean generally across the UK.
So we'll be kept updated and briefed, you know, as things transpire. I think the fun hasn't started yet, has it?
That's probably the description.
Okay. Oh, Martin.
Thank you, Chair. I guess one question which is flagged by one of the bullet points towards the bottom, which says continued engagement with SSP. Clearly, SSP, Shared Services Partnership, have a major role to play here in terms of business continuity around Brexit, particularly with the IP5 stores, etc. We at Audit Committee for Shared Services Partnership had an update in terms of its risk register and it having Brexit on that risk register. I just wondered about what continued engagement looks like, because ultimately this board has oversight of the activities of SSP as well, and whether that needs to be sort of broadened out rather than just continued engagement. Further updates need to include what they're doing, because perhaps whilst we as an audit committee might see it, I'm not sure the whole board is cited.
Yeah, it's a good point, Martin, and perhaps it's just loose wording. I mean, just to give you the assurance that when it says continued engagement, we have a weekly Brexit group, and they are around the table as any other part of our organisation. So we see their risks, we see their action plans, we get a sense of assurance or not. So it's not just you know, how you're getting on. They're just the same as the cancer service or the blood service or corporate. They're part of that discussion about how does Velindre NHS, University NHS Trust manage the challenges in front of us. That's how we're approaching it. And it works well because both in terms of them as an organisation, as part of our organisation, but also then as us as a customer. So we do get that sort of two dimensions of the place. So hope that reassures you. It's not just, can you send us some stuff occasionally?
Yeah, thanks. I think that is helpful to be assured that this paper covers the entirety of the organisation.
Including hosted bodies. Thank you, Martin. So we note that update. Thanks, Carl. So the next item, and so do you want to speak to 5.3.2, or we covered that, Carl? I think, have we?
Yeah, I think we've covered that, Chair, unless there's any further questions.
I think so. Thank you. So 5.4 is Remuneration Committee, and I'm down to speak to this. It's a very straightforward report where we just noted some redundancy payments and approving the remuneration for board level appointment. It's a quick meeting. I'll take any questions. If there are none, we note that update. And 11:31, I'm a minute out. We now have a 10-minute break. So I'll see you all at 11:40. As if by magic, here you all are. Welcome back, everyone. We're now at section 6 of the report, which is the strategic development. And the first item is the Strategic Development Committee highlight report. Stephen Harris, are you, I hate saying surnames like this, but we've got so many Steves. Stephen Harris, can I hand over to you to talk us through the highlight report, please?
Section 5.6, Chair.
Yeah. One item ahead of this, I think, is the Donna or not? 5.6, as Martin says.
5.6, is it? Delivering Excellence Performance Report. That's
the
paper I've got up. Yeah, okay. Are you doing this, Kath?
I am, yes. Okay, so thank you, everybody. The first thing I wanted to is to highlight that you have been provided with a copy of the full quality, safety and performance report that went from each of the divisions to the first quality, safety and performance committee. rather than just the summary performance management framework that we would normally discuss at this section. But that is just to illustrate that to you, the completeness of and the entirety of the information that went to that committee. I am going to focus you on what we would normally discuss at this stage, which is just a number of key elements from the performance reports from both of the divisions, and then I'm going to hand over to Sarah Morley, who's going to take us through some of the workforce data, and we can have a little bit of an additional discussion on that based on some additional information that she's provided for us this month. So
before you start, can I congratulate you on the cover paper again, which really gives us a roadmap, you know, in terms of what we need to look at as particularly as independent members.
Thank you, and I have to admit to the help of Peter Gorin this month, who has normally it's me, but this time it was him. So I would just like to thank him for continuing that practice that we've now got into. So thank you, Chair.
Thank you.
But I can't take credit for his work. I've got a few more details as well, a few more numbers to add to the narrative that Peter's kindly prepared for us. So, you know, we discussed when we last met the continued challenge that we have in terms of capacity with all of the infection control prevention measures that we've put in place to manage during this period of COVID, and also the impact on the service of recommencing the treatment for patients that had had their treatments deferred during the first phase of the outbreak. I'm pleased to tell you that we had made improvements in the SAC provision, managing to maintain the service levels and continuing to work on them, as we mentioned earlier, starting to move to repatriate patients back to being treated in the outreach facilities in Prince Charles, and working with the Royal Gwent as well, working with an Iron Bevan to re-establish the service out in Neville Hall. So our SAC service provision continues to be challenged, but continues to be prioritised based on the clinical framework that we're using. We are continuing to enhance our provision by increasing our medicines at home and oral SAC provision, and we're maintaining that at around 270 patient episodes over and above where we were for that pre-COVID. And we're also continuing to utilise additional capacity in outpatients and moving patients where their treatment is suitable from provision in the outpatient in the SACT department to being treated in the outpatient department where it's safe and effective to do so. We have managed to reduce the longest wait that we've had from 49 days in August to 31 days. And we will continue to provide you with the details on that longest wait as part of our data set as we go forward. We have initiated a process of ring fencing beds for emergency patients so that we're able to respond to their need. We're also continuing to maintain our radiotherapy targets and provision. We noted that in September we had a 7% increase in referrals over and above those that we received in August. That was an increase from 310 to 333. But we've managed to maintain both our radical and our palliative treatments at 94% of that 100% target. This is down to a number of reasons, which include process delays, which are due to COVID related capacity. But that's not necessarily on the LINAC machine. You remember last time we met, we talked about the implementation of hyperfractionation, which reduced the number of visits that patients were having to make for radiotherapy. But in fact, that enables us to see more patients. But what that does is it still has an additive effect in terms of the planning work that has to go on. So some of the breaches that we're seeing now are down to the pressures in the planning process rather than in machine capacity. But we're continuing to work on how we enhance our systems and processes to take some of the delays out of that. The only other thing to draw to your attention was just some of the patient feedback. We continue to very closely monitor that and noting that some of the concerns that we received were around access to the outpatients department, and we now have in place the canopy in the car park. Having said that, that doesn't mean we should only be accepting the fact that we're able to provide that. It's actually about streamlining the systems and processes that enable us to make sure that we've got effective patient flow through the clinics, and that again is subject to ongoing work. We have established a hub within the outpatients department now that is coordinates the virtual appointment provision. So, we introduced that very quickly at the start of the outbreak, and now playing sort of catch up with some of our systems and processes and trying to coordinate those in a more effective way. So all of that work ongoing for our outpatients as well as the SAP provision. So as I said, listening to that patient feedback and responding to that as effectively as we can. I'll just pause there a sec to see if there's any questions on the VCC before I move on to WBS, if that's okay, Chair.
Yes, thank you, Kath. Stephen Harris, you're on mute, Stephen, just to let you know. There we are.
Yes, just a quick question, Kath. As you know, I'm, like all colleagues, very interested in the canopy, the practical arrangements outside the cancer centre. So I was up there yesterday or the day before yesterday in the car park. I've seen, so I'm sure there's a better word than the tent. There's a very impressive structure there, which is really excellent to see, to protect those waiting in the car park. I'm just wondering, have we abandoned any possibility of an actual canopy over the entrance to protect people being dropped off in ambulances? Was that considered to be not practical at the end of the day? Because I've not been updated on that recently.
Yeah, there are some practical considerations that we're still working through. It hasn't been abandoned, but we're still trying to meet some of the practical considerations. But I'd be more than happy to touch base with you next week or so on that if you'd like an update.
Kath, some of the difficulties that we're experiencing, with phlebotomy having to be services brought in-house, some of the cancer services getting back on track, which means we've got more referrals coming down and so on. That together with COVID, that's going to last for some time.
Yes.
And I am noticing on social media, nowhere else, that people are noticing how busy it is and how sometimes the outpatient department is a bit crowded and busy.
Yeah. The biggest pressure on outpatients at the moment is phlebotomy. So we had, during the initial outbreak, we had a cessation of phlebotomy services in primary care, and we're still working through with the health boards how we can actually repatriate those back to that primary care service. So we've seen tremendous increases in the number of patients attending for their phlebotomy, particularly those for whom it's crucial in the days before their SAC treatment commences. So we are working on that, but what we're also working on is an opportunity to recite within the VCC site the phlebotomy provision, just try and take it away from that outpatients and to ease that area. So we're working through the estates options on that at the moment. We've got several plans that are running in parallel, but we're hoping to initiate that as soon as we possibly can.
So that will reduce the busyness as well, won't it?
It will,
because the phlebotomy patients are in and have their blood test and then they presumably go home.
They do, and we've been looking at how we extend the site, and we've explored the use of WBS trailers to bring them on site to find a temporary accommodation. But as I said, we're still working through a number of those options. We don't envisage, certainly not with the vaccination programme coming down the line and the role that primary care will have to play in that we will be able to repatriate the phlebotomy services that we currently had to bring back centrally to VCC. We're continuing the discussion with the health boards, but I think that repatriation is highly unlikely for the foreseeable. So,
were we consulted on we just seen, we'll just repatriate that back to Velindre.
So it happened in March. When the
back in March, yeah,
it did. So it was one of those things. There were conversations around it. We were informed that that was going to happen, but we had to respond very quickly to be able to meet that. And the team in Velindre have responded very ably to make sure we can increase the capacity, extend our provision, and then to prioritise our patient flow through it to make sure that we weren't interrupting any elements of patient treatment. But I said I really think it is something that we're going to have to continue to work through over the forthcoming months.
So do we need to be looking at a substantive solution rather than, I don't mean any offence, a make do amend solution, because if it's not going to be repatriated back anytime soon, then we need you know, a proper solution. I'm not saying that you wouldn't do a proper solution, but you know what I mean, Kath? Something that's going to be long lasting, so we need to do it properly.
Yeah, so I think if we look at timescales, I think we're looking at temporary, interim or long term. In this case, I think we're looking at interim, and the solutions that we're looking to in place are interim in nature. So it's not just a sort of temporary fix. So so we have identified a site on site, and we're just trying to work through moving it there. But we will continue to have discussions with the health boards. I think the movable feast about the vaccination programme at the moment causes an uncertainty that we hadn't anticipated at this time, because we had already started discussions with the health boards about that repatriation. But as we've noted, things are changing on a daily basis again.
Thank you. Are there, Stephen Allen, you have some comments?
Yes, just pick up on Kathy's point there. Thanks for that, Kath, really important. On the repatriation of phlebotomy services, obviously if there's going to be a long-term change to that on the way the patients will access that, you may want to have a conversation obviously with CHCs around the area because obviously there'll be a formal service change process.
Yeah, absolutely, Stephen, and we absolutely note that. I think at the moment we're not anticipating it's going to be a long-term change, because what we need to do is to do what our commitment is, which is to make sure that patients are able to access services as close to home as possible. So we really will be looking to make sure that those services can be put back out to the community as soon as possible. That's a really key focus to us. So I wouldn't anticipate at this stage that it is anything that's a sort of formal consultation with you around a permanent service or even longer term service change. But I think your point is well made, and I do think it's possibly something we should be advising the local CHCs about, just about the ongoing change to the provision that's now going to be for a little bit longer duration than we would have anticipated initially. So thanks, we'll pick that up with you.
Thank you.
Colleagues, this is a slightly different format that this report is presented to us. Is everybody content with this format? Managing it all right? We got a bit more of a balanced scorecard. Well, it's not balanced scorecard, it's pie charts actually. But I think the plan is that we'll move towards balanced scorecards in due course. But is everybody able to follow this new format? Yeah.
Yeah, this is a journey again, and I think every time we see it, it improves.
Yes, Martin, thank you for that.
Just to pick up on that, Chair, we received at the Strategic Development Committee, we received a presentation from Peter Gorin, which outlined the process that the team there are taking, working with us to revise the performance framework and how we actually deliver that. And we are working to see how we can use Power BI as a tool to maybe put additional information and data on some of the graphs and the way in which we present the information to you. So again, that will work through over the forthcoming months.
Thanks, Kath. I've just one last comment before we move off from this section. Looking at the VCC divisional report, mindful this is a public document. When you look at the table on page 15, where you've categorised things into red, amber and green. It's a bit disconcerting when you see that large column of red. Now, yes, from the explanation that you've given us, we understand, you know, in these circumstances and in this context, I think, you know, this we're doing extremely well. But I'm just wondering if we could write something there to give the public assurance.
Mm-hmm. Fine, thank you. I'll take that back to the team in terms of how we present the information. Okay, yeah. So just very quickly then, sorry, WBS, sorry, Chair.
No, I would be a bit disconcerted if I saw that table, that bank of red, and I would think, well, what's happening? Yeah. And a lot of the missed targets are not missed by very much at all, which is reassuring. And in the context of what we're facing with COVID and repatriation of services, we're doing remarkably well. So absolutely. I think a narrative just under there to reassure our public would be helpful.
Okay, thank you. That's
that on board.
Point well made. I'll pick. We'll pick that up.
Thanks, Kath.
So in terms of WBS, we are continuing to maintain our stock. You remember at the end of August, beginning of September, we had a period where our stock levels were not in difficulty, but they were quite tight. But we're now in a healthier position. We are continuing to have a challenge to our productivity in terms of both our laboratories and our blood donation. But obviously that is because of the additional interventions that we're having to put in place to be able to manage the service in a COVID period. So I think we've discussed that on a number of occasions, and that still maintains. There was an increase in platelet waste over the bank holiday period, August into September, and that was that shows in the September figures, and was a result of the increasing stock holding that we have to have over a bank holiday period, but which was also met with an unexpected drop in demand from the health boards, which together came to an increase in waste. It was one of those events that we can't plan for, I'm afraid. But obviously a full analysis of that has been undertaken. Then just want to celebrate the quality incident closure within 30 days. We've had a 10% improvement on that between August and September, and achieving the target. And you know that's one that has dogged us for some considerable time in terms of the work that we've been doing to get those incidents closed out with an effective quality report and within that time period. So I just wanted to highlight that as well. And that's all I want to bring to your attention. Thank you.
Open this for discussion. Any comments from the board? Thank you. Do you want to speak to the trust-wide, Kath?
Sarah's going to pick that up. Thanks,
Sarah. You okay? So, Sarah.
Thank you.
I can't see Sarah.
Oh, there you are. I'd just like to begin by describing what you've got included in your papers. So you've got the trust-wide performance report, which in the papers is reporting to for the year month to September. If we can begin with that, I'd like to give you some more up-to-date numbers, as I often do. By the time we get to the meeting, we've often got the previous month's data. So I can give you the data up to the year to October. So our PADR has improved slightly to 70% for the trust. Sickness levels 5.19% for that rolling year, and statutory mandatory training compliance for the core statutory training framework 10 components is 81.26%. So slight improvements there on the month that you've actually got in your report. What we've also done for the first time, just responding to colleagues' requests, really, completely appropriately asking for some more breakdown in relation to COVID-related absence. And what you've got specifically in the performance report in front of you, for the first time, is the breakdown of special leave, and that's COVID-related and non-COVID-related special leave. And if I can just remind colleagues who may have seen this in the first wave of the pandemic, when we were regularly coming to board with some of this information, is the COVID-related special leave actually looks at medical leave where people are self-isolating, and that could be self-isolating because family members have tested positive, or it could be that they are well enough to they're symptomatic but actually not on sick leave, as it were. So this special leave is an additional category which we give to managers to define that, and these are people who are not able to work from home in their full capacity, which is why they're actually recorded as special leave. Also then, what we've done this month is included an extra 2 slides in the information pack, which actually breaks down some of this information in a little bit more detail, because particularly, we're very, very keen at the moment, aren't we, to think about well-being, and the sickness absence prevalence actually plays right into that well-being agenda, which is actually at the core of so many conversations that we have across the organisation at the moment. So the two slides there, the first one there looks at COVID-related workforce absence. And what we're doing there is giving the board numbers of people, so head count, sickness and head count of absences, because I think that just puts it into context, is how many people are we talking about. Percentages are all very well and good, but actually how many people are we directly supporting and how many people are we helping managers support in terms of absence, some of which now will be long COVID. So we do have a couple of people across the organisation who are on long-term absence as a result of COVID-related illness. So we can see some of the numbers there. We've actually got 2 weeks in this breakdown, and you can see that the numbers have slightly improved in some capacity between 1st of November and 8th of November. And then we've also got below that the percentage of sickness in the divisions and percentage of special leave in the divisions, which are being experienced in those same weeks. On the last slide then, what we've got is workforce absence. Colleagues did ask last time in board in September if we could start to see the breakdown by absence reasons, just to give us again more of that context and background. And what we can see on this is the all sickness absence rolling as of October, as I just said, is 5.19%. And then the COVID related absence for the full year, so this is the full year effect for COVID, is 0.67%. So you can see that our COVID absence is a very small proportion of our overall sickness absence, and that's taking the whole COVID period into account now, which we've not done previously. And I think that's probably quite a helpful number to see. As we are getting more months into the pandemic, that becomes more of a relevant figure for us to look back over the time period. What we can also see there is a complete breakdown of absence reasons, which clearly we use within the organisation on an ongoing basis to monitor the proportions against different absence reasons. And anxiety, stress, depression is still very much at the top there in terms of percentage of absence, which is 33, so a third of our absence is related to that. Very much less absence occurrences, of course, because they're longer absences. So that accounts for the slightly smaller numbers there. And what you can imagine is chest and respiratory problems is where we're now seeing the high proportion of COVID-related absences fit into that category. So hopefully this has given you a much bigger flavour and bigger overview and context for the overall absence and reasons. And I'm very happy to take questions, Chair.
Thank you, Sarah. Martin and Gareth, you've been concerned about some of these figures and how they were presented in the past. So I'm going to ask you if you've got any comments to make. Martin, I saw your hand was up anyway.
Thank you, Chair. Sarah, this is terrific. This is exactly what I think I was after in terms of understanding the context. So again, as always, the information that's coming in front of the board, it continues to improve, and I found this really helpful. Thank you.
Good. Thank you.
Gareth?
Thank you, Chair. I echo Martin's comments as well. I think the breakdown is really informative. I was struck by the anxiety, stress, absence reason, how high that was comparatively against the other reasons for absence. And I'm assuming that we are doing things in the background in order to address these absence reasons where we can within the trust.
Yes, if I can respond to that, Gareth, absolutely. And of course, those anxiety and stress absences are at the heart of the OD programmes we're putting in place across our wider change implementation as well. So whilst we're doing specific work with those individuals and with managers to support them and giving them a variety of interventions that they can access, we're also recognising that we need to plan and work within the organisation in a way which reduces stress and anxiety, so that this is a whole holistic agenda. And of course, we are considering this in so many different contexts.
Yeah, thank you.
Steve Ham.
So I was on mute. So I'm just wondering whether it would be helpful to take some trend analysis on that one into the QS&P committee for next time, so we can get underneath it, and maybe a little bit of benchmarking. The number is huge, and Gareth, it really stands out.
Yeah.
So we can see when we can just start to get underneath it a little bit more.
Yes, thank you, Steve. Well,
that's helpful. Kath?
Thanks, Chair. Could I just add that our endeavours to support our staff who are stressed, anxious and depressed isn't dependent on where the origin of that is, but also to point out that that figure isn't only people that are stressed because of work, it's people that are stressed because of personal reasons as well, which obviously is more than added to it at this time. That doesn't mean we're tackling it any differently in terms of our advice and support that we're given. But I do think it might be useful just to point out that that isn't work-related stress per se.
No, that's an important clarification. Thank you, Kath. I notice on, nobody else's hand is up. Oh, Sarah, you want to come back?
Yeah, just very, very briefly, just to reiterate Kath's point and build on it a little, actually, absolutely right, Kath, that we are looking at this as in a holistic way. So, for example, we support financial well-being, we support a number of facets of well-being beyond those, actually, which are directly work-related. So we do treat the individual here as a whole rather than work-related issues.
Thanks. My comment, again, another act of pedantry, but on page 3, there's a table which is prepared for a bar chart, and it hasn't been populated.
I think there seems to be a quirk of IBAB's, Chair, but we will look at it again.
Oh, okay. Because I noticed that this is PADR completion, and I would expect this, but there's been a roughly 10 percentage point decrease in PADR completion since September 19. And I'm not surprised to read that, but we do need to keep an eye on it to see if we can't get it back up.
Yeah, we are keeping an eye on that as itself, but actually we're also reinforcing the need for managers to have these quality discussions with their staff. So whether or not it's recorded as PADR, it's an ongoing conversation with staff, which very often at the moment involves elements of well-being, elements in some people's circumstances of home working. So we've got a number of facets of work actually which support quality conversations, which is at the heart of the PADR process.
Thank you, Kath. Can't see anybody else. Oh, Jan.
I know this is on another matter, but I know that the Future Generations Commissioner announced yesterday that as part of the 16 days of action against violence against women and domestic abuse, that her organisation as an employer would look to provide a grant and a loan, potentially a loan, to employees who were living with domestic abuse and wanted to flee. Because people in employment cannot go into refuge on the whole, because the cost of refuge includes all the staffing costs, so costs are prohibitive. And Sophie Howe has been working with a victim, Rachel Williams, the lady who was shot in Newport some years ago, to look at what the barriers are to members of staff seeking help. And the greatest one is when you're in employment, being able to put the deposit down and move on. So financial issues. I just wonder if as a NHS, and I know this is much broader than us as a trust, that we begin to look at that, whether or not we could begin to take steps forward in that area. Along the lines of what the Future Generations Commissioner, she's put it out as a challenge to all organisations as of yesterday. And I wonder if we could, because we know of the increase in domestic abuse during the COVID period with people working from home, work being a safe place often for people.
Thank you, Jan. We will look at that.
Thank you. So we note the update, and we acknowledge and welcome the changes in reporting format, which That's excellent. And I can now move on to section 6 of the report. Stephen Harris, if you could take us through the committee highlight report. No, that's right, of the Strategic Development Committee. We've had our first meeting of the Strategic Development Committee, which you chaired, Stephen. If you could take us through the highlight report.
Yeah, thank you, Jay. Yeah, so this, as you say, is the first highlight report. We had the first meeting of this new committee on 5th of November. Interesting, I've sitting on both that and the Quality and Safety Committee. A huge amount of agenda items on quality and safety. Understandably, far fewer items on strategic development, but very, very big items with some very large sets of documentation. So just interesting contrast there and quite appropriate. So again, I'm going to presume people have read this in advance. There are no matters to alert or escalate to the board. In terms of advise, one of the first items was around the terms of reference and the cycle of business. We then had an update on the engagement process, which ultimately is around the Trust's goal setting, eventually leading to the Trust's 10-year plan until 2030. We had a very interesting update and presentation on the development, the ongoing development of the South East Wales acute oncology business case. And that's a process that was put in train predominantly by the health boards through the South East Wales Collaborative Centre Leadership Group back in March 2020. And this is about putting in place a team, an MDT basically, to review current acute oncology service provision across South East Wales. Huge range of disciplines involved with this, and they're moving now towards producing a business case which they hope to complete in December, and from that then to seek funding for new and improved models of acute oncology service delivery, probably from 2021 onwards rather than before that. That was a very, very interesting update we received on that. Yeah. And then the two other items we've already touched on. We had the Performance Framework Review. Kath mentioned that earlier presentation from Peter Gorin, and Lauren mentioned earlier, and we talked about the Trust Assurance Framework update. So those were the main areas that were discussed at the first Strategic Development Committee meeting.
Thank you, Stephen. Any questions? Stephen, I gather it's going to be the nature of the beast. There will be fewer items, which we will have quite detailed debates about. That's the nature of strategic planning, isn't it? So
indeed, I think that is the actual intent, that we actually will have the time to get into some of the relevant detail on some of the major strategic developments, rather than getting perhaps overly engrossed in debates about fine detail about things going on a day-to-day basis. So that is definitely the intent of this committee.
Thank you. Steve, Ham?
Yeah, I just think this is one of those where we need to learn how to use this committee.
Yeah.
We've got more space there now to use it as an organisation, to get up to speed, to form things, to shape out our future. And I think certainly we as an exec group need to learn how to use it. I mean, I have that discussion as a board about and learn and adapt to how we want to use this committee. It could be quite powerful for us, I think, in terms of shaping our direction alongside the strategy that will come sometime next year. It'll get us into that. So how are we going to implement this? So I think it can be a really real force for the organisation in terms of taking us forward.
Thank you, Steve.
Yeah, I'm just going to say, it was the first time, I think, since I joined the Trust, I actually managed to finish a committee meeting on time.
Yeah, well, I don't know if that's going to happen today. Let's see how we get on. If there aren't any other observations for Stephen on that item, I'd like to go to 6.3, which is the TCS programme comms and engagement update.
I think this 6.2.
Have I missed something again?
Yeah, you're doing this deliberately to test us, I think, Donna.
I am, yeah.
So 6.2, I think, next. The
scrutiny subcommittee highlight report. Yeah, I just put a tick against that. Okay, Stephen, over to you again.
Okay, thank you. So this is just a highlight report for the last meeting, which was on the 12th of November. Again, I presume people have read it. Nothing to alert or escalate to the board. In terms of advice, we've received an update on the TCS programme financial report, which is there for you to read, but basically the upshot of that, which I'm sure Mark will maybe touch on in more detail in the finance report, is that we've now received the necessary approval for the capital funding for the programme for the current year, some of which relates to post-OBC approval work, and obviously we await OBC approval in due course, and obviously that funding won't be released until that particular stage, but again, Mark will ensure update us on that. Again, we had a discussion around the risk register as part of the trust-wide assurance framework, and we also had update on comms and engagement. That comes as the next paper, which I'm sure Lauren will update us on.
Yeah.
And Steve has already touched on the Nuffield report update. And again, Steve has given us a more updated position we received at TCS. So nothing else really to add to that, Chair. We'll come back to some of these, or certainly the finance report a bit later, I'm sure. I'm happy to take any questions or comments.
Any questions, observations for Stephen? Carl?
Hi, Chair. No, I just thought I'd add a bit more information on one important aspect. So, as we sit today, we're expecting to go to infrastructure investment for Welsh Government on the radiotherapy satellite centre business case on the 9th of December. So clearly that's an important part of the overall drive to improve access for services across the region and then ultimately improve outcomes. So we're just waiting for confirmation, but we believe that's the 9th of December.
Is that Iron Bevan putting that paper forward, or are we putting it forward?
Yeah, they're lead. So Nicola Pagodich, my sort of counterpart in Iron Bevan's, is leading the project because the facilities are built on their estate, but clearly the service is our responsibility then. But the two organisations have been invited to IIB on the 9th.
Thank you, Carl. Okay. I think it's better if I go from this. So 6.2, just done 6.2. So we move to 6.3, which is Transforming Cancer Services Programme Communication and Engagement Update.
Thank you, Chair.
Lauren?
So this paper, which we had some discussion on in the scrutiny committee as well, as Stephen referenced. Just touch briefly on a couple of the sections. In terms of the engagement on the clinical model, the work that's been referenced around Velindre Futures and the cross-section of staff clinical across the organisation who have been involved in that work. It was really important to us from a comms and engagement perspective to be open and transparent about that. So all the terms of reference for that work, the ongoing progress and highlight reports are being shared internally on our internal intranet. So that's been one focus of the comms on the clinical model. The second is around, since we last met, the Nuffield Trust publication of the start of their work was a focus, and we basically directed all our stakeholders to the Nuffield Trust project page for where they set out their terms of reference and approach to the work. And as Steve referenced, we are just finalising with them the next stage of publication of that report, and we'll be able to share more details of that with the board when we're able to. From a public engagement perspective, when we spoke last time at the end of September, we touched on the creation of a new Facebook page where the engagement on future developments from an infrastructure and service perspective, we think are best to be channeled through. The launch of that work, the launch of that page is going to coincide with the publication of the Nuffield Trust recommendations, so that that can be a space where from the start of the engagement on those recommendations with the public, that we can do that through that new channel in an effective way. And behind the scenes, the plans to for the ongoing content into that and the moderation and logistics around it have been progressing well and are ready to go. We touched on this at the last meeting, but the Senedd Petitions Committee had only just met at that point, and we hadn't yet had the follow-up formally from them. So this paper just notes that in terms of the follow-up questions that we were asked as an organisation following that committee. And then the final point I just wanted to touch on, as referenced in the paper, is the ongoing importance through all of this in terms of our own staff engagement and the encouragement of open and honest two-way discussion with them. And this has been further enabled over the last period as well by the launch of the Working Confidence programme, which Sarah is the exec sponsor for.
Thanks, Lauren. I just wondered if you were going to say anything about supporting planning requirements, because that was an important step forward as far as the enabling works are concerned.
Yeah, it wasn't, only because we were prepared from a comms and engagement perspective in terms of the success of the plan and application, but we didn't actually proactively do anything around that because we wanted to, this is an important milestone in an overall journey, and we didn't want to kind of focus too much on some of these milestones as we go through. So I don't, from a programme perspective, whether Carl wants to comment.
Well, just what you've said, really, Lauren. I mean, it's part of a number of activities that are going on, but ultimately it's just preparatory work. I think the key is Lauren's, really making sure that the important conversations going on about clinical matters, patient experience, staff are the central ones. Sometimes the planning stuff gets in the way of it, doesn't it? Because it's technical stuff. I think that'll just happen. I think it's more important to how do we want the future to be, and how can people be part of describing that really exciting future, which does really put patients, families and staff in the centre of those conversations, not people in talking about planning applications. So I just support what Lauren and Sarah said a little earlier, Chair.
No, that's absolutely right, Carl. I think I was just reflecting that we actually haven't informed the board, maybe this is not the right place to do it, haven't informed the board that that planning application was granted.
Sorry, I do apologise.
Yeah, so I accept absolutely the comms perspective on it. I accept that completely, and your points, Carl. But just for the board to note that that planning application went through and unanimously was supported. So we're asked to note that report. Any further questions or observations? Stephen? Alan?
Thank you, Chair. Just wanted to check on the engagement side of it. It would be really helpful for us as a Community Health Council to see the whole raft of engagement you've had during this process you've been going through, so we can actually undertake some scrutiny of that to make sure that we're confident and that we are able to sort of provide you some independent commentary on that. Would really helpful. I know you've had the Nuffield response or the Nuffield process, which I was part of. So we'll obviously look at that alongside of the engagement that you have. So that can be sort of shared with the CHC. I can then share that with my colleagues, and we'll come back to you certainly to have a further conversation.
Yeah, that would be really helpful. Would appreciate your having a look and your views on it. That would be great. Thank you, Stephen.
Stephen, you were phasing in and out a little bit then. I was leaning right in to see if I could hear you better.
Yeah, sorry, I got a bit of a chesty cough. That's why I was sort of...
Okay, sorry.
Yeah, that's quite right. I do apologise.
No problem. So that was 6.3. 6.4 is the Academic Partnership Board Highlight Report. This is a board that I chair, and we've kind of had our first meeting, which was in 2 parts. And the first part was us sharing with our university and other colleagues our views, aspirations, and our skills and our strengths and so on. And then part 2 was where that was reciprocated by our academic partners, and we had 5 universities attend for both meetings, which is very encouraging for us in terms of taking this work forward. And we're now moving into a stage where we'll meet with each individual university to discuss what we might want to take forward as a collaborative, and then we might act as a broker where we think perhaps we can bring, say, 2 universities and ourselves together, that sort of thing. But I think that this committee, this has got off to our board has got off to a very good start in terms of involving our academic partners, and I'll take any comments on any matter that's listed in the highlight report. If there aren't any, no, then we note that update, and we come to section 7 of the report, which heading integrated governance, and the first is 7.1, which is the financial report, which, Mark, I'm going to hand over to you to take us through this section.
Yeah, sorry, thanks, Chair. Yeah, the report that you have is the position at the end of September. It's a little out of date, I appreciate that. There has been a more recent report, only just produced actually, but wasn't available for the distribution of these papers. So there has been a few developments since this report was produced, and I'll mention those as I just take you through some of the key messages. You've got the detailed report as usual, the 30-page detailed report in your pack, but I'll just refer to the cover paper, which hopefully will give the main, as I say, the key messages. Section 2, the cover paper, there's a table there just in terms of the overall position, the very high level targets. You can see everything is shaded green there, which implies that everything is on track to outturn within budgets and targets. So that's still on track, and the position at the end of October, of month 7, there's no change in that respect in terms of the latest situation either. Just turning specifically to the revenue position, the revenue budget, the board will be aware that throughout the year, and actually every meeting that we've had, I've reported that we are on track to meet our statutory duty to break even on the revenue side, but it has been conditional upon actually getting additional funding to cover the additional costs of expenditure associated with COVID. And you can see it, section 2.3 there in the paper, the actual level of the unfunded element of our forecast costs of COVID, as reported at 3.7 million at the point this was prepared. That did actually increase slightly to just over 4.1 million actually in recent weeks. I think it's positive in so much that we have had discussions with government, well, throughout the year actually on this, ever since we started incurring these costs. We've always had sort of discussions around reimbursement. The expectation has always been there, but there's never been any formal request or confirmation. But we have actually had that now. We had a meeting actually with government on the 4th of November, and we presented our case. And through a bit of challenge, a bit of exchange, they did report positively on our position after that meeting and confirmed that funding would be made available. There's a bit of process to go through, as there usually is with these things, but we do hope to actually have access to this money by the end of this month. So that was positive.
Good.
Just in terms of capital, Stephen mentioned earlier on, actually there's been a development with our capital budget as well. Again, I've been reporting to the board previously that we have been waiting for confirmation of capital budget from Welsh Government for the enabling works projects and the new hospital project within the TCS programme, just over 3 million. We've now had formal confirmation of that funding letter, which has been signed and returned. So again, that's a positive development. And of course, that actually does allow us then to progress with our plans for actually distributing the remaining discretionary capital budget that we've got. We were withholding that decision because of the risk around this confirmation. But we have been making plans, we have been mobilising things in the background to make sure that we can hit the ground running, so to speak, when that confirmation has come through, so we can deliver on our priorities within the discretionary funding element as well. COVID capital costs, we've had quite a lot of that actually already. We had it early in the year, around £1 million. We have actually asked for around another £500,000, which we're expecting to receive. And again, we've had positive noises that that money will be made available. But again, we just need to go through a process and confirmation of that. So I think the overall position, since I reported previously, is that we're on track to deliver on our expectations, but it's not really conditional anymore because we've had that confirmation which we've been waiting for some time. So I think we can move forward with some certainty now, and we can make those plans on a definite footing. That's really the main messages I had to give today. So I'll just take any questions.
Thanks, Mark. Again, you know, the cover paper is a very helpful roadmap to take us into the body of all the figures and tables and so on. Very helpful. Thank you. Are there any comments, questions for Mark on the financial report? It's a very positive report. I'm pleased to note the outcome of the meeting in relation to COVID, because we would be in trouble if that funding hadn't come through. And very pleased also to note the capital funding that came through, which releases our discretionary capital funding programme now, doesn't it? So this is a very positive report. Martin.
The one thing that does, Chair, is create a fact that we're now heading towards the end of November, and the end of the year is coming headlong towards us. And as always with capital, there is a time lag between getting the money and getting it spent. Are we in a position to have sort of shovel-ready activities to get that money out the door by the end of March?
Yeah, as I said, Martin, we were conscious of time elapsing, and as you rightly say, these things, you know, do take a little time to actually get up and implement it. But we were making plans, as I said, in the background prior to actually getting formal confirmation of this money. Yeah. So we've got a fairly detailed capital plan, and we've been collecting the priorities from the divisions in order to make sure that we can, as I say, hit the road running. We are presenting to the executive board actually on the 7th of December a formal plan for the remainder of this year, which will basically discharge all of the remaining discretionary money that we have. We've already actually issued around 800,000 earlier in the year, recognising that we had to get on with some of the priorities that we'd identified. But there remains about £1 million of that money that has been identified and allocated provisionally, seeking confirmation, as I say, on the 7th of December.
Thanks, Mark. That's helpful.
That's really helpful. Any other? Stephen Harris, and then Carl.
Thanks for that, Mark. I just want to pick up on Martin's point around actually being able to deliver on the capital programme by the end of the year, and how challenging that can be. And then separately and earlier, get an update from Carl on EU and Brexit. And I'm just wondering whether we've done any assessment around the risks, or we maybe actually order stuff and believe it's available and then discover there are hold-ups on perhaps importing things or on licensing things, actually that becoming a problem rather than availability. I don't know whether we've done any, whether we even need to do an assessment on that. Obviously, it depends on exactly what it is we're spending the money on, but I know a lot of stuff can come in from overseas. So I'd say I don't know whether we've done anything on that.
Yeah. Do you want me to pick those up?
Yeah, okay.
The first one, yes is the answer, Stephen, to your important question. In terms of sort of medical devices, equipment, supply chains, I think everything that we believe is needed and can get done either side of Brexit, whether we have a deal or don't have a deal. That's the level of sort of diligence that's been applied. Now, you know, things do go wrong, so I'm not going to hand on heart say that 100%, because I'll be sat here in about 3 months explaining why one thing didn't get over the line. So as best we can, yes. In terms of delivery, yes, we can get it all delivered. There'll always be a bit of, it's a bit tighter this year because things have been caught up in COVID and Brexit. So that's the second. But the third thing I just wanted to add, really, it goes back to the conversation a little earlier about the Strategic Development Committee and our refreshed 10-year plan and supporting strategies and plans. I think it's been tricky this year, but what we are and will do is to then look at a sort of 3 to 5 to 10-year capital investment plan as well. Because clearly some things have a 10-year life cycle, don't they, around big equipment. We understand some of our facilities and buildings. So really this year is trying to reshape our future direction of travel over a 5 to 10-year period, and then really start to get alignment and congruence between some of those enabling things, workforce and other things which are important. But also that does enable us to move from, we've still got a sort of 1 to 3 year capital program, which has been disrupted this year because of COVID, but really thinking about that long-term plan, and also in how do we get different types of investments to support our development. It can't all be capital. So how do we start to get into strategic partnerships with other partners who might be able to come up with some form of mutual or shared investment through grants, so on and so forth, where we don't just have to rely on the capital program, because we do know that that's, you know, there's not enough capital to get everybody's needs addressed. So I think there's a longer term position we're trying to arrive at as well over the next sort of 5 to 10 months.
Thanks, Carl. Very helpful. Kath?
Yes, just very quickly to provide Stephen with assurance, we've done a piece of work over the last couple of years preparing for Brexit that maps the supply chain for all of our products, components, requirements that come from overseas. Shared Services have done it for all of the ones that they hold within their warehousing system, and we've also done that for BCC. For WBS, it's a larger list that's outside the sort of regular NHS supply chain. So those supply chains are all fully mapped and understood. And we've done an assessment on the stock that we'd need to bring forward to enable us to have resilience over that changeover period. So all that work was already done prior to the delays in Brexit that we've had, and that's what we're now revisiting. But to rest assured that we've got all of that information to hand to understand those supply chains.
Thank you, Kath. If there aren't any other questions, Mark, have you got anything to add before I wrap this agenda item up?
No, I don't think so, Chair.
Okay, thank you. So we endorse the contents of the finance report. And once again, Mark, I found the covering paper very helpful as my roadmap to get into the main body of the report. I'm not financially technically minded, so I found it extremely helpful. If I can move us on to 7.2 then, which is the Audit Committee highlight report. Martin.
Thank you, Chair. As hopefully you can see, the highlight report stands for itself. One item particularly to advise the board about is about the transition to the Strategic Health Authority, moving NHS into something that's going to be called Digital Health and Care Wales. We had an update, and it was very helpful to have the 3 SROs for the 3 streams in the room at the time. Helen Thomas from NWS, obviously Steve Ham here for representing Velindre, and Ivan Evans representing Welsh Government, and they all attend Audit Committee regularly, which helps us be able to join the dots. We've agreed that we're going to have an additional Audit Committee, particularly focusing on this transition programme, and that's going to happen early December. I think a date is in the diary, it alludes to right now. And just to add some current information around this item, board members might be aware that Bob Hudson has been announced as being interim chair of that organisation. And the eagle-eyed amongst you might also have spotted that adverts have now been launched in the last few days for a vice chair and 5 independent members. It takes 7 board members in total to run NWIS. We managed to do it as a subset of our hosted body amongst our 7, so that says something. So just to let you know about that, we're going to keep a track on that as well. The other items on the agenda are very much for information. There's nothing really to escalate, but just to show the range of activities that we covered.
Thank you, Martin. A lot of work to get ourselves in a position to transition NWIS into a new SHA. So appreciate the burden that's been placed on certain sections of the trust. Could have done without some of that right now, but there we are. We're responding to it. Any other comments, colleagues, for Martin on the highlight report? Thanks, Martin. Again, a very well populated report, which is really helpful. In the past, they've been a little bit sparse, but I got a real feel from this report as to what was discussed in the committee. No hands up, so I'm going to move to 7.3, which is the charitable funds highlight report. That's me. I chair that committee. So just to let you know that we had, for the first time, I think, or certainly since my tenure, a presentation from one of our ambassadors, Wayne Griffiths, who talked about his work in fundraising as an individual on behalf of the charity, and it was inspirational, and he's collected over £500,000 in funds which have been presented to Velindre since 2012. I thought it was an excellent opportunity for us to hear about the fundraiser's experience and for us to share with the fundraiser what we're doing with the funds that have been raised. So it's a two-way process. It worked very well, and we'll continue with that and have intermittently other fundraisers to come and share their experience with us. I wanted to tell you it's a challenging time for all charities, and we are no different. It looks, we did recast our the budget focus for this year in light of COVID, and we are likely to make that income. And one of the reasons why we are likely to make the target is because we had a very generous one-off donation from the Moondance Foundation. But as we go into the next financial year, it is going to be a very challenging year. And some of us are going to get together and talk with the fundraising team about how we maximise our opportunities to fundraise. We are able to have access to NHS funds. You know, you've seen all these fundraising activities that on the television where they say we fundraise for the NHS. We're entitled to apply for a share of that, and some of those funds have come to us. And then to let you know that in January, we have to submit the trustees' annual report to the Charities Commission. There's a draft report circulating now. We do need to finalise that as soon as possible in order to get it ready for a December meeting of the committee. So if anybody hasn't had a copy of that report and would like to see it, please let me know. And if you have seen it and read it and you've got any comments, we really need them as soon, you know, in the next day or two, really, to enable staff to finalise the document. Martin, thank you for all the comments you've already made, which have been taken on board. I've made some comments as well. So hopefully we'll be ready to submit that report in January and be compliant with our statutory duty to the Charity Commission. We have appointed 3 new ambassadors, or we've invited actually 3 ambassadors to become ambassadors. I have written to them. I've had a reply from one of them, and when I've had all the replies in, I'll announce the names. I won't announce the names prior to a reply in part A of the meeting, but I'm hopeful that we will have 3 new ambassadors. I'll take any comments. If not, we come to the Shared Services Audit Committee highlight report, which again is you, Martin, I think.
I'll save the best till last. Yeah, again, this is hopefully a straightforward report. There are no issues to alert and advise to the members of. You will see the range of activity that the committee received papers on and received assurance on. One thing that's probably worth pulling out in a little bit more detail is on the 3rd page, which talks about governance matters. And specifically, we had a very detailed report from NWIS from the Shared Services Partnership around contracting for items of PPE specifically and other areas related to COVID activity. And very helpfully, we received a schedule of all the major contracts that have been let, together with their progress through the process, to make sure that we had absolute clarity of the chain of approvals and delegations, and what items have been delivered, and in fact some contracts that have been cancelled. This is an area obviously heavily in the news right now because of the work that the NAO has done in England, and there is no doubt that we have paid higher prices than we would have paid in other times, but absolutely we've worked really hard to ensure that we get proper value out of all these contracts. And indeed, some of the negotiations have released millions of pounds of savings on being able to find better prices in other places, and as a result some contracts have been cancelled. And I think it's been a very creditable position that we've managed to make sure that PPE has been delivered across NHS Wales without any major dramas at all, and that the costs have been kept down to reasonable levels. And of course we make sure that we get assurance of own funding from Welsh Government to cover all these things, as Mark indicated in his finance paper earlier.
Thank you, Martin. And I think the due diligence system that we've set in place in this trust to support NWIS in this has worked very well. So we were never at risk of losing substantial amounts of funds in the event that a contract either wasn't delivered or was of poor quality, through using escrow accounts, doing due diligence on new companies coming into the marketplace and so on. So Stephen Harris and Mark, thank you for assisting in setting up that system, which I've lots of positive feedback. And we've got an audit trail, as you say, Martin, through every single one of those procurement requests. Are there any comments, other comments from Martin? Thank you. I have not been informed that there's any other business. That being the case, the date and time of the next meeting is the 28th of January. Happy Christmas to those I may not see before the 28th of January. And so therefore I am now going to ask the board to adopt the following resolution: that representatives of the press and other members of the public be excluded from the remainder of this meeting, having regard to the confidential nature of the business to be transacted, publicity on which would be prejudicial to the public interest in accordance with section 1, paragraph 2, Public Bodies Admission to Meetings Act 1960. And I will see you at 1:30 for part B. Thank you.